Hi everybody, welcome to Wisdom Wednesday. It's Wednesday afternoon here in the midst of August, starting to cool a little bit. We haven't seen 103 for the last day or two, which has been great. I'm getting ready to go on a trip to Florida to a certification course for peptides, and I thought I would review a peptide today that's a lot of folks have been asking about, and that is a peptide called Semaglutide, which is a GLP-1 type of agonist. It's a lot of fancy letters and terms here, so let's kind of break that down so you know what that is. But first of all, just understanding what a peptide is. So a peptide is a combination of amino acids. As I've explained many times, proteins come in sequences and series of amino acids like a string of pearls, and then they're clumped together in some type of formation to make it a protein. But when we bring things into the body uncurls that sort of string of pearls and then breaks it down into single amino acids. And when you have a group of amino acids, say less than 50 of them, that is considered to be a peptide. Anything over 50 amino acids is considered to be a protein. But semaglutide, you might have heard of it in terms of Ozempic or Wegovy, and now there is the new oral form called Rybelsus, and or Rybelsus, I guess. These are now products that are being used and have been FDA approved for weight loss. They were initially utilized in type 2 diabetics, and now we are seeing studies being done and approvals being made for this just as a weight loss tool. So as such, let's just talk a little bit about what it is and what it does. It's a hormone that's this GLP-1. It's a glucagon-like protein 1, and it is a protein that is produced in the small bowel. It stimulates insulin secretion and it inhibits glucagon secretion. And so by doing both of those things, it lowers blood sugar. So they tend to be short acting, and they hit the receptor of the GLP-1 receptor and can lower insulin spikes and glucose spikes after meals. And it slows emptying so that it may help us feel more full for longer and therefore produce weight loss for lots of folks. Now, these receptors are all over the body. So just wanted to walk through some of the overall benefits of this type of molecule in terms of what it can do. For instance, in the brain, it can help reduce food intake. It reduces fluid intake as well, so it's important to stay hydrated, but it increases neuroprotection and increases the growth of new nerve cells. In the heart, it increases glucose utilization. More glucose is taken up in the heart. It's protective for the heart. It increases output of what is happening from a contractile standpoint, so cardiac output. It will cause some mild vasodilation, and it reduces fatty acid metabolism. In the kidney, it increases diuresis, so we're perhaps making a little bit more urine. It will lower inflammation in the body. It increases glucose uptake in the muscle. It increases thermogenesis in our brown fat. It increases lipolysis or breakdown of fat in fat, and therefore by increasing glucose utilization, we can maybe reach into some of those fat cells and can burn fat. In the liver, it helps to lower glucose production. It also lowers VLDL and ApoB, which is related to cholesterol and our lipids, and it can lower some of the fatty liver that we see occurring. It is very beneficial as far as the pancreas is concerned because it increases beta cell proliferations, and beta cells are those cells in the pancreas that help produce insulin. It decreases beta cell death, and it helps decrease glucagon secretion as well. It helps with slowing gastric emptying in the stomach, again, helping us feel more full, and it also lowers acid secretion, so it's possible you might have a little bit of some mild nausea and or some reflux. So these are not uncommon side effects. This particular type of peptide is generally an injectable, and what we're seeing with Wegovy and Ozempic is that we're having a hard time getting patients to meet criteria so that it's covered by insurance. But there are some compounding pharmacies out there that are compounding it, one of which we have a compounder that's doing a semaglutide with some vitamin B12. And in doing so, we are able to provide this for patients at a much reduced cost than what the pharmaceutical type products that are coming in a pen. Now, these are very beneficial if you can do the pharmaceutical products, because it comes in a nice little pen that you just slide on individual needles and then can give subcutaneous injections, and they're just once a week. But for the ones that we have to get through pharmacies, they come in vials, we have to mix them, and we draw them up in small syringes. Not a huge thing to do, easy to teach and easy to help you understand and learn how to do this. Now, when it's prescribed, it's also a gradual escalating dosing so that you become acclimated and that you really do limit side effects, and most people do quite well. Most of the studies that have been done have been in studies that have been around 20 weeks, 16 weeks of escalating the dose, and then a longer time period of maintenance. But in these studies, particularly the 20-week studies recently, have shown that there is about 14 to 15% reduction in weight over that time frame. So that's pretty significant and certainly beats placebo type treatments as well. So if you are interested in these types of things and might be interested in going with a peptide that is secreted from, that is made in a pharmacy and not using the pharmaceutical product, then please let us know and we can help you with that. And as such, we like to monitor and just make sure you're doing well. There's very few contraindications, but for those people who are very sensitive and really just don't tolerate it, obviously that's a problem. And for people who've had thyroid cancer or a history of thyroid cancer, either a C-cell or medullary or some of the endocrine neoplastic type syndromes, those are contraindicated as well. There appeared to be some increase in C-cell type thyroid cancers in rodents. We have not seen that in humans, but as such, we are being very cautious as far as prescribing for people who've had thyroid type cancers. So anyway, this semaglutide in the form of Ozempic and Wegovy pharmaceutical, but in terms of the ability to get this peptide in an injectable form through a compounding pharmacy is available and significantly more affordable if this is a direction that you'd like to use or a tool you would like to use for weight loss. Hope you all have a really good week, and we'll look forward to following up after my meeting next week. Hopefully I'll have a lot more to share about different types of peptides. Have a great week.